Over the past few decades, there's been a convergence in research between the graft and other implant space. In the 1990s and 2000s, research came out suggesting a role in porosity for both bony ingrowth as well as retention of mesenchymal stem cells. More recently, literature has been published showing a role for the submicron surface of materials for polarizing immune cells to promote predictable healing. This slide summarizes a few calcium phosphate-based grafts, and you can see they each have vastly different surface topography. Kronos, for example, has these large flat macular granules and minimal porosity, while Magnetos has a submicron topography composed of submicron needle-shaped structures. This is what a Magnetos granule looks like macroscopically, and then zooming in, you'll see these needles come into focus. The needles of Magnetos provide traction for pro-healing M2 macrophages. These macrophages then recruit in mesenchymal stem cells and provide the necessary instruction for them to differentiate into osteoblasts. On the opposite side, other materials promote a pro-inflammatory pathway that's predominated by these M1 macrophages, leading to scar tissue formation and non-unions. At Curos, in addition to having a well-defined mechanism of action, we have preclinical evidence showing how Magnetos works in vivo. This was a canine paraspinalis muscle pouch study where Magnetos and 6 conventional grafts were implanted via blunt dissection. After 12 weeks, they were removed, sectioned, and stained with histology. You'll see bright pink throughout the core of the Magnetos graft, denoting bone formation, while most of these other grafts were fibrous tissue, denoted by the bluish-purple color, or a residual graft, the brownish-black. This is the first study that revealed that Magnetos can grow bone in the absence of pre-existing bone, as well as added cells or growth factors. This is growing bone by itself in a muscle pouch in dogs. Next, we turn to a clinically relevant instrumented posterolateral fusion study in an ovine model. In this study, we noticed creeping edge repair from autograft at 6 weeks, suggesting that it's serving as an osteoconductive scaffold. In comparison, we saw creeping edge repair occurring from Magnetos, but if you look in this turquoise circle, you'll also notice that each of the granules is serving as a nucleation site for new bone to form. At 12 weeks, we saw complete bridging bone in both groups, and 26 weeks, healthy remodeling characteristic of trabecular bone. We have over 20 human clinical studies that have been initiated as well. These can be found in our global research summary. Of note, based on the discussion prior with Dr. Sama, you'll notice that we have a number of human clinical trials that will reveal level 1 evidence, one of which is published in Spine. This study was an investigator-initiated, prospective, multi-center, intra-patient controlled study looking at posterolateral fusion where Magnetos granules were placed standalone with no other graft material on one side of the spine, and autograft was placed standalone on the opposite. The autograft had to be at least 50% iliac crest derived and was volume matched to Magnetos at each level. 91 patients received fine-cut CTs at 1 year post-op that were evaluated in 3 planes by 2 independent blinded spine surgeons. What they uncovered is a 79% fusion rate with Magnetos, while autograft fused 47% of the treated levels. This study was powered for non-inferiority, but the authors even indicated superiority in the discussion of this manuscript. To illustrate one example from this case, this is a 70-year-old female who had a 4-level posterolateral fusion with Magnetos placed on the left side of the spine and autograft on the right. Magnetos fused all 4 of the levels in this patient, while autograft fused 2 of the 4. And you'll notice even at those 2 levels, there's more robust bone formation in response to Magnetos. So to conclude this section, a few things that distinguish Magnetos are a clear mechanism of action rooted in immunology, high-quality level 1 evidence, and the ability of Magnetos to form bone in a muscle pouch in a canine model without the need for any added cells or growth factors or cadaver-derived tissue.